Hey guys, here to talk to you about Medicare. This video is intended for people brand new to Medicare, and I got to tell you, I feel so sorry for you. My mom, when she went through the Medicare transition, I remember she called me on the phone. She said, "Hey son, congratulations!" And I'm all excited. I'm like, "Well, congratulations for what, Mom?" She goes, "Your industry finally overcame car warranty people as the most obnoxious sales force on the planet because she just had enough of it. 14 advertisements a day. It's just ridiculous. So I am so sorry." But thank you very much for your time and attention today. Very excited to help you out on this. So let me get rid of these floating controls here. And all right, so first off, just a general disclosure that I do not offer every plan in your area. I currently represent 9+ different organizations that offer about 85% of the plans across the country. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program to get information on all of your plan options. A little bit about me. My name is Tim. I've been in the insurance broker, focused on the retirees, so the four main staples with Medicare, life insurance, long-term care planning, those tax-deferred asset programs, those programs that participate in the gains in the market, but never the losses. So if the market goes up 10%, you get 10%. But if the market loses 10%, you don't lose anything. But I'm excited to talk to you about Medicare. So about me, I've got a beautiful wife. I've got two awesome kids, and I have the world's most okayest dog. She's sweet as honey, but she makes scary cats look brave. So she's cute, but she's timid. So two quotes about me that I try to live by, but I'm by far not perfect, but I still do my best. Is those with good intentions make promises, those with good character keep them. And I try to show that I have a lot of character and not just intentions. And then this one again, far from perfect, but I try to live my life so that those that know me but don't know Christ want to know Christ simply because they know me. If you're looking for a local representative, I will be a local representative because I live where I park it. I'm a full-time RVer, and I'm licensed in all 50 states. So with Medicare, who's eligible for Medicare? It's any United States citizen that's 65 or older, or somebody that's been on disability for 24 months, unless you get diagnosed with like end-stage renal disease or Lou Gehrig's disease, something like that. Then they skip the 24 months and go straight to Medicare. So how do you sign up for Medicare? So if you're still working, your coverage, you may not even need it. Your coverage, if you or your employer still, or you or your spouse are still working, as long as your employer has at least 20 employees, you can continue staying on the employer coverage. Just continue with Medicare Part A, which is the free benefit. If you have the military benefits like VA, it's credible coverage for your prescription drugs, but not credible coverage for your medical. And if you have TRICARE, then yes, you must have Medicare Part A and Part B. Then you get on TRICARE for life, and that takes care of a lot of stuff. If you're healthy and you don't want to sign up, you'll start paying later. Do want to let you know you are subject to penalties if there are, if you do not have any coverage whatsoever. So the first steps are going to be sign up for Medicare A and B. You can do that online with Social Security, SSA.gov. Call 1-800-Medicare, go to your local state or local Social Security office, or you fill out a paper application and go to it. Once you get that, then you have a decision. You can go with a Medicare supplement and a prescription drug plan, or you can choose from one of the many Advantage plans options, and I'll go into that a little bit later here. So Medicare Part A, as an apple, this is no cost, covers as long as you or your legally married spouse worked for 40 quarters or 10 years. There's no payment whatsoever. If you do not have the 40 quarters, then it could be $506 each month. Hospital, this covers the hospital. If you go to the hospital, it's a $1,632 deductible for the first 60 days. If you're still in the hospital for beyond 60 consecutive days for any one hospital stay, that's $408 per day. And then if beyond 90 days, you go to your lifetime reserves, and it's $816. So this is, $1,632 deductible per hospital stay. It's not an annual deductible. It's a per hospital stay deductible. Typically, you're only in the hospital for 1, maybe 2 days, and then they scoot you over to a skilled nursing facility or a rehab hospital where it'd be $204. I'm sorry, 0 for days 1 through 20, and then $204 per day for days 21 through 100. And then all costs after that are your responsibility. Medicare Part B is everything else. It's all doctors, specialists, cast splints, x-ray surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, chemotherapy. I'm sure I'm forgetting a thing or two, but get the point. Everything else other than the room and board that Part A covers for the hospital. The standard premium is $174.70. If you have an income that is less than like 24,000, the state might pay a portion of that for you or all of that for you. And then on the flip side, if you are blessed with a high retirement income, then you might have to pay what's called an IRMA, and that would be here's the brackets and everything like that that you see there. As far as the prescription drug plan, this is Part D. There's no prescription drug plan that's actually offered through Medicare. They're all done through private companies. They can be part of the Part C, which is known as the Advantage plans. Again, I'll kind of go into the breakdown between the Advantage plans and the supplements in just a few minutes. But as far as the prescription drugs, there's kind of, these went into effect a while ago. And so kind of how these work is they break down the drugs into 5 different tiers, but you have different stages. So the first stage is the deductible. It's a $545 deductible is the standard deductible. After you go through the standard deductible, then you're in the initial coverage period. This is where they kind of give you a flat copay to pay for prescription drugs. They usually break down the drugs into 5 different tiers. You have your preferred generic drug, your non-preferred generic, your brand name, non-preferred brand name, and then your specialty drug. Once you get beyond that, then you fall into the coverage gap, which it used to be big and scary. They call it the donut hole. You used to have to go back and pay 100% of the donut hole again, or of the drug cost again when you're in this category. But now you pay 25%. 70% is the manufacturer discount. 5% is covered by your plan. You only have to pay 25% of the drug cost throughout that period. And so you reach a dollar limit of 8,000. Once you reach 8,000, then you're in catastrophic coverage. And catastrophic coverage, you're 100% covered for the rest of the year. So that's the good news. There is also an IRMA when it comes to the Part D plans as well. So again, if you are blessed with a higher income, retirement income, you may have to pay a little bit of a surcharge. And again, on the flip side, if you are on the lower income side of things, then you may get that waived. The state might help pay a portion of it or all of it for you. So when it comes to Medicare, again, just to reiterate, Medicare Part A is the hospital benefit, covers you in the hospital for days 1 through 60. It's a big hefty deductible of $1,632. The Part B is all things medical. There's a pretty reasonable deductible that has been increased to $240. I apologize. That's the 200. That's the 2023 numbers there. Part C plan are known as the Advantage plans. Advantage plans are all covered by private companies. So the way that these came about is if you have Medicare Part A and Part B and only, and you need like an MRI and you wanted to go to find out how much that would be, there's really no way of knowing what the cost would be until after you get the service rendered. You have no idea what the MRI place is going to bill Medicare. You have no idea what Medicare is going to come back and approve, and ultimately no idea how much your 20% is going to be until after you get it done. So these private companies went to the government and said, hey, I think we have a solve for this. Why don't you have Medicare pay us? We'll take over as primary for Medicare, and we'll essentially have all of our clients sign a contract with us that lets them know exactly what they are financially responsible for per service rendered. So it could be $0 for a primary care doctor, $40 for a specialist, $250 for an MRI. And I'm just making up numbers just as an example for this, but that's kind of how that works. So forget about the 20% and the deductibles. You sign up for an Advantage plan, you're just responsible for the copays listed. And then your prescription drug plan, again, you have the 5 different tiers: the preferred generic, non-preferred generic, preferred brand name, non-preferred brand name, specialty, and then you kind of have the standard where you have the deductible, initial coverage period, the donut hole, and then that. So a lot of people going, well, I've heard of Advantage plans and I've heard of supplements, but what exactly is the difference? The difference is this. An Advantage plan, if you sign up with any of them, and there's a bunch of them out there, and I know you guys have got just a ton of mail from them. So you have United Healthcare, Blue Cross Blue Shield, Aetna, Humana, Cigna, just to name a few. And with this, there'd be a very low or no additional premium whatsoever. In fact, one of the trends of last year is that they started coming out with plans that would pay a portion of that Medicare Part B, that $174.70 for you if you join that plan. And then you would just have to pay copays as you go to the doctor. Because these are done through private companies, they are network based. So you do have to find out if your doctors are in the network. It's possible that you would need referrals, but most plans got away from the referrals during COVID. They didn't want you to go to the primary care doctor, risk getting infected, and then go to the specialist, wait in the waiting room, and risk getting infected there. So usually you can go straight to a specialist. And then all of these plans have a maximum out of pocket. So if something catastrophic happened and you racked up like $20 million worth of medical bills, you don't have to pay copays always and forever. There's a limit to how much those copays could be, which is usually less than 7,550. I've seen them as low as I think $800 in some states. And then as far as the prescription drug plan, usually it's included. Now you can get it without, especially if you're a part of the VA or something like that. And then these are the plans that have all of the extras. So the dental, the vision, the gym memberships, the over-the-counter items, the hearing aids, that kind of stuff. And your estimated cost for the year would just be your Medicare Part B premium, plus the Advantage premium, and then whatever copays you use for the year up to the max out of pocket. And then as far as the supplements are concerned, it's a little bit different setup. Medicare remains primary, so the bill goes from the doctor to Medicare A and B, and then your supplement or your secondary kind of picks up what's left. So there would be an additional premium, but there's typically no copays. The plan I feel most comfortable putting people on, or if you're in a state with standardized plans, would be the G plan. If you're in a state that doesn't offer the standardized plan, it's the A1 plan, where all you would be responsible for is the Part B, as in boy deductible, that $240 out of pocket. But with this, with Medicare being primary, there's absolutely no network and no referrals. If you came down with the heebie-jeebies, and I love using the heebie-jeebies because it's made up and I don't wish anything on anybody. But if you go to the best heebie-jeebie specialist, and they're in Denver, you can fly to Denver, knock on his door and use them. I would highly recommend getting an appointment first, though. But there is no prescription drug plan with this as well. And there's usually no extras. You might be able to find one where it has a discount program for vision or dental, maybe a gym membership, but typically they don't come with any of that. And so your estimated cost for the year would be your Medicare Part B as in boy premium, because you do have to pay that regardless of which choice you make. Then your supplement premium, and then your prescription drug premium as well. And so that's kind of how those plans work. But I want to thank you very much for your time and attention throughout this video, and very much so looking forward to helping you out and seeing if there's anything I can do. Thanks. Bye.